Hi, we're back. I'm Jake Denell, a physical therapist. This is my student, Josh Ostro. We're glad you could join us. This, of course, YouTube is sponsored by Lincoln Orthopedic Physical Therapy, a private physical therapy clinic in Lincoln, Nebraska. And if you have any questions about spinal stenosis, feel free to call any of our 3 offices, which will be listed also at this website. Thanks again for joining me, and we're going to cover a little bit about chair yoga and spinal stenosis exercises. And this should help you quite a bit if you do have back pain and you get relief in sitting. The first thing we notice with Josh is he's sitting in the typical college gaming position, which is not very good for you. We want to have good posture or yoga posture. So Josh, could you sit up, right straight up like this? That's very good. And so if Josh sits up nice and tall in what we call a military position, this is not good posture either because it's the end of the range. And if he slumps down like this is not good posture either. It's the end of range the other way. Good posture is really balanced. So you're going to come up, sit up on what we call your sitting bones right there, as tall as you can. He's going to reach up, and then what he's going to do is flatten his back out just a little bit to open that space for spinal stenosis. And then he's going to come back to about 10% like that. Good posture just means good balance. That's number 1. Okay? Now, as I mentioned before in part 1 of this presentation, I talked about when you flex, you open up that spinous process, you open up the space a little bit more in your vertebrae, creating more space and sometimes relief by about 25% more space. So what we want to do is try to increase flexion and improve flexibility in sitting. The first exercise that Josh is going to do then is he's going to spread his legs apart like so, and he's just going to forward bend like this, dropping his head down, and you can see how this opens up his spine very nicely, and you'll feel a great stretch in your back. I like to hold this between 20 and 30 seconds. Remember, when we're stretching, we want to stretch softly, slow, easy, and gentle. This should be pain-free and should give you relief. Okay? So this is the first stretch, which Josh demonstrates very nicely and very easy to do. It's like bringing your knees up to your chest when you're laying down. Okay, Josh, can you come up for me next? Next, we're going to go ahead and bring his knees together. This is for the less obese patients. And the more flexible ones, he'll come straight down like this. Again, his knees are to his chest, just like this. He doesn't get quite so much stretch in his hip rotators as he did in the first one. His head's down nicely, and he gets a nice little stretch there. Okay? So this stretches his back very well, opens up those vertebrae as much as they can. The next stretch I'm going to have Josh do is his hip rotators. He's going to put one leg over the other, like that. Excellent. He's going to put his hand down like this. And this stretch is a little bit vigorous. And you just, again, you want to stretch gently, coming forward. And again, you'll feel a nice pull. This time you should feel it in your hip. Josh, any place else you feel it? For the YouTube audience, anywhere else, like in your hamstring, you might feel it here a little bit if you lean forward. And that's where you would feel that one. So this stretch is what we call your hip rotators. And it's a great stretch because that sciatic nerve runs right straight through there. Again, how long? About 30 seconds or so is usually very good for that. The next stretch for your spinal stenosis is your hamstrings. And I'm just going to bring a little stool out for this. Josh will put his foot up like this. It's better if you bring your foot up. We call that dorsiflexing your foot. And he'll come forward, and here you'll feel a great stretch in your hamstrings. And that's where you should feel it behind the back of your leg. Remember, we're stretching softly. Many of you won't be as flexible as Josh, who's a great athlete, as you can tell. Super flexible. But that all said, you should feel a nice pull. Again, stretching softly. And it might pull if your arms or if your hands are right here. That's fine. Wherever you feel that pull in your body is good. The more flexible your hamstring, the better. Okay? The next stretch we're going to do is a little bit different. Is to get that lower quadrant. Josh is going to extend his one leg. Can you do that, Josh? And then slide to the edge of the chair, please. Okay? Then take your leg out to the side. Run your hand down like this. Then he's going to take this arm up like this and sort of stretch. Now this stretch you're going to feel not only in your hamstrings, this is a great yoga stretch, but also in the lower quadrant of your back. Again, just stretch easy, nice and easy, about 30 seconds, just like that, stretching softly. Very good. And then, of course, we're going to do it the other way, just like this. Going to open this up like this. Josh is going to come up like this. And you see, again, you should feel a nice pull, not only in your lower back on the opposite side, and the back of your leg. On a 0 to a 10, if 0 is no stretch and 10 it's killing me, no more than a 5. Nice, easy, and gentle. Okay? Great. Thanks, Josh. That looks really good. The next stretch, again, done with good posture, is what? The rotation stretch, Josh. You can put your arm out, your nose follows your arm, and you're just going to try to get that rotation, if you can, at the edge of the seat. And you see how he pulls and rotates. Again, you're going to get very good rotation here. That opens one side of the back and then closes the other side. And then as he comes nice and slow, straight over, arm straight, just perfect. Great. Nose follows the arm like that, and you can feel a nice little pull like that. Okay, good. And then you might do 3 or 4 reps of that, and then switch, and then do it the other way. And wherever you feel the tightness more in your spine, just hold that a little bit more and don't push it. Remember, no more than a 5 in that stretch, and then back. And again, most of us aren't going to be able to go as far as Josh, but he's easy to demonstrate that way. Former pitcher, so he's got great flexibility of his upper extremities. Good, okay, so that takes care of the rotation, the flexion, the hip rotation, the hamstrings. Now next we want to try to strengthen your core a little bit. For this one you want to sit at the edge of the chair again, sit with good posture, and bring your arms out forward, Josh, and then down if you don't mind. And then we're going to alternate your opposite leg and hand. So it's going to, remember how we did this? Yeah, opposite, Josh, good. Yeah, good, very good. This strengthens your core quite a bit and your abdomen muscles, which is really, really good for you. And I like the rate Josh is doing this. Nice and slow and controlled. Moderately strenuous, but not too strenuous. And maybe 10 to 15 reps with each side is a good number, like that. You see how he maintains good posture. Very good. And this is an excellent, excellent exercise for your core. Again, done in sitting, and sitting is a better position for your spinal stenosis rather than standing. Okay, good. Our next exercise then actually does go to standing, and so Josh, if you wouldn't mind standing up. Now we know that standing isn't the best position for spinal stenosis, but a couple stretches really do help it. The first one, Josh, is let's just go ahead and put your foot from the side here and put it up on a chair. Okay, that's your hamstrings, which is good, but yeah, let's bring it up like that, and just bring your arm down and grab hold of that chair and pull like this. Again, you can see how your knee comes to your chest. This opens this up here. It's a nice stretch on your hip, a very nice stretch on your knee, and a very good stretch for your lower back, opening that space up. It's a good way to get relief like that, so even in standing you can get some good relief with that. Okay? Back down, and we'll switch. We'll do the other one as long as we're doing that. Josh, that's excellent. That looks real good. Again, you'll see this here. Same thing, 20 seconds to 30 seconds, slow, easy, and gentle. That looks excellent. Okay? Very good. Okay, the next stretch is, in case we want to try to get everything, the lower back, the glutes, the hamstrings, and the calf. And this you can use a sink that works really good for you when you're up and standing for a while, or you can just use the back of a chair. If I pull this chair like this, Josh will grab this, he'll bring his head down like this, he'll pull, and he'll stretch back, and you can kind of see how he pulls that, and here you get a stretch right here in your hamstrings, your glutes, and your lower back, your upper back, and your arms all at the same time. This is an excellent stretch for spinal stenosis. And again, 30 seconds at least, maybe 2 or 3 reps, nice and slow and easy. And I really like this stretch. It's been very, very effective for that condition. Okay, back up. Okay, so basically those are the stretches we like to use for you for spinal stenosis that we covered. And if you have any questions, you can email us at south@loptonline.com. And again, this has been brought to you by Lincoln Orthopedic Physical Therapy. Have a great day.